Health is a vital component of any society. A health system consists of all organizations, institutions, and resources that produce actions whose primary purpose is to improve health. In the year 2000, the WHO listed three main goals for a health system: good health, fairness in financial contributions, and responsiveness to people's expectations. With the growing number of infectious diseases globally, health security has also been included as a vital additional element to these health system goals. Professor Damian Mills is the Deputy Director and Provost and Professor of Health Economics and Policy at the London School of Hygiene and Tropical Medicine. She observes how the emphasis on health security has impacted the health system.
This emphasis on global health security has led to a concern with adaptability and resilience of health systems. Resilience, the capacity of health actors, institutions, and populations to prepare for and effectively respond to crises, maintain core functions when a crisis hits, and informed by lessons learned during the crisis, reorganize if conditions require it. We need resilience in the face of crises and pandemics, but we also need to recognize that health systems face many challenges, and therefore what might be called everyday resilience is important. Ability to be resilient in the face of routine and multiple challenges.
The WHO has identified four main functions of a health system. Firstly, financing the health system. Secondly, service provision. Thirdly, resource generation, ensuring that human resources, physical capital, and pharmaceuticals are made available to the system. And finally, stewardship, which includes regulation.
So these functions are provided in a system characterized by four main players. In the top left-hand corner, the population and patients who seek care from health providers and may pay them directly. The providers of services who provide those services. And then thirdly, the pooling and purchasing agencies who may receive money from people, give them financial protection, and reimburse providers for services. And then on the right-hand bottom corner, the government and professional bodies who both handle some of the payments and also have the responsibility for regulating the entire system.
The COVID-19 pandemic has had a direct impact on all four of these players in the health system.
So firstly, the impact on population and patients. There's been reduced access to care. For example, that may have happened because people have been asked to work from home and services are less accessible to them, or it may be because they've fallen out of employment and their healthcare coverage was associated with their employment. There's been a reluctance to seek care, whether because of fear of infection at health facilities or awareness that health facilities have been overburdened with COVID treatments. Secondly, the impact on providers of services, most obviously perhaps in the death from COVID of providers, in illness, in burnout related to COVID because of the huge pressures on health providers. We've seen the balance of provision pivoted to COVID and a reduced ability to provide other services. There's been accelerated online provision of professional services and self-monitoring. In the UK, for example, a lot of GP consultations have moved online, and there's been greater reliance on self-monitoring of chronic conditions and less frequent follow-up at health facility. Thirdly, impact on pooling and purchasing agencies. There's been the reduced insurance coverage as people's employment decreases, seen, for example, in the US. Pooling and purchasing agencies have seen an enforced change in priorities, having to devote huge volumes of their resources to deal with COVID, which has led to the backlog of non-COVID treatments. And also, I think COVID has accentuated the problems of disinformation on healthcare products, particularly with the attention paid to vaccines, to vaccine hesitancy, the anti-vax attitudes, and to information about treatments and what treatments might be used for COVID. And then finally, impact on government and professional bodies. Obviously, first and foremost, the huge cost burden of COVID, especially for governments who have the resources to spend and to divert to COVID. De facto, an increased role of government, which has been to a greater or lesser degree a comfortable increase for governments. Very visible conflicts and coordination challenges between agencies and levels of government, perhaps tested coordination within the health system as never before. And increased tension between societal and individual needs and preferences in decisions on lockdown, when to relax lockdown, and what approach to take to COVID.
Despite these challenges, the COVID-19 pandemic has provided an opportunity for countries to reflect and reconceptualize their health systems to make them more adaptable, responsive, and equitable. This is especially true regarding the public health element of the health system. Any public health system must coordinate with several public, private, and volunteer entities. Therefore, in designing public health institutions, the assigning of roles and responsibilities between the central government and local authorities is key. The COVID-19 pandemic has shown that a system that can quickly harness local resources and relationships is vitally important. Considering the lessons from the pandemic, several significant changes in health systems design can be expected in the future.
I think they'll be more decentralized. There'll be more initiative in the hands of patients, households, communities, and local agencies. A trend we've seen coming anyway, but which COVID will accentuate. There'll be a more diverse provider market, greater participation of private sector agencies directly interacting with clients, not via a professional gateway. I think we'll probably see that coming in more rapidly in low and middle income countries, since the ability of professionals to slow down the pace of change is greater in higher income countries. I think there'll be much greater online advice, monitoring, and support to maintain healthy lifestyles, accentuating the pre-COVID trend. I think that governments and professional bodies like medical and nursing associations will struggle to regulate and coordinate, and this will need new approaches fitting the digital age and particularly addressing the challenging issue of data governance. I hope that we'll see stronger national and local public health systems, for example, with effective early warning, surveillance, and management of infectious disease, more coordinated global, national, and local agencies, and standing research capacity that is able to rapidly respond as new pandemics hit us, as they surely will in future.